Good morning. We're going to be giving you a comprehensive analysis of Methodist hospitals. My name is Kiera Lede.
My name is Sienna Smith.
I'm Taylor Hall.
I'm Layla Bell.
And I'm Brianna Gentry. Next, welcome to Methodist Hospital. It is a leading healthcare system in Houston, Texas, known for its exceptional patient care and medical expertise. It also features specialized centers for emergency services, imaging, breast care, and outpatient treatment. Into their mission, beliefs, and core values, Methodist Hospital is committed to delivering high-quality, cost-effective healthcare while ensuring the best possible value for the individuals that it serves. Also, the healthcare system is grounded in the principle that every person is of sacred worth and created by God. Into the industry competition, Memorial Hermann, HCA Houston Healthcare, and Baylor St. Luke's Medical Center are significant competitors to Houston Methodist, each with its own strengths that challenge Methodist's position in the healthcare market. With these hospitals, they create a competitive environment that drives innovation and environment in inpatient care, pushing Houston Methodist to continually enhance its services, adopt new technologies, and maintain its leadership in quality healthcare. With this competition, it ultimately benefits the community by raising the overall standard of care in the region.
I will be discussing the competitive challenges facing Methodist Hospital. Despite facing significant challenges, Houston Methodist Hospital has developed a comprehensive plan to reduce staffing shortages, embrace technological growth, and meet rising patient demand, all while continuing to deliver the highest quality and most innovative care. Workforce shortages caused by staff burnout and the growing focus on clinical audits and documentation often overshadow direct patient care. To tackle these issues, the hospital has implemented 3 innovative strategies: ambient intelligence, which will be leveraging technology; virtual nursing, which is outsourcing documentation to allow in-person nurses to focus on care; and then remote patient monitoring, which uses advanced devices to support both inpatient and outpatient care. These initiatives not only address workforce shortages and integrate technological advancements, but also help meet rising patient expectations, ensuring the hospital remains competitive. Concepts from Chapter 4, Section 3D, organization, in our textbook highlight the importance of a strong organization utilizing resources effectively. Houston Methodist Hospital demonstrates this through its strategies addressing challenges while maintaining its reputation for delivering exceptional, innovative care.
Next, we'll be talking about some institutions within Methodist, and institutions are the humanly devised constraints that structure human interactions. Some formal institutions are laws, regulations, and rules that are followed, including government regulations, educational partnerships, and healthcare accreditations that play a significant role in shaping the operations and policies at Houston Methodist. Houston Methodist have standards set by formal institutions like the Joint Commission, who accredit healthcare organizations across the U.S., and this requires the hospital to follow specific protocols for patient safety, care quality, and operational efficiency. Another act put in place in the Houston Methodist is the Health Insurance Portability and Accountability Act, which is HIPAA. This act sets ethical and legal standards that ensure examples like patient data remaining confidential and hospitals operating without engaging in fraudulent practices. To abide by the formal institutions put in place, Houston Methodist must also practice community health obligations, which are obligations that include conducting community health need assessments to identify and address local health needs like mental health services, preventive care, and health education. Next, we'll take a look at 3 pillars of an institution, and the first one is regulatory pillars, and this pillar is built on regulations and laws that govern the healthcare industry. And for Houston Methodist, for Houston Methodist, regulatory framework includes compliance with federal and state healthcare laws, as mentioned before, like HIPAA and the Joint Commission, and regulations from bodies like the FDA and CDC. Next is normative pillars, and these elements are based on values, norms, and social obligations that are widely accepted within the healthcare community. At Houston Methodist, this includes an ethical commitment to patient care, and these norms are embedded in the hospital's mission, which emphasizes on leading in research, innovation, and compassionate care. And lastly, we have cognitive pillars, and this would encompass the shared understanding of what it means to deliver quality care and the hospital's commitment to innovative research-based practices. This includes the organizational culture, which emphasizes teamwork, continuous learning, and a dedication to advanced medicine.
So with the patient care and international trade, this ties into Chapter 6. Methodist Hospital patient safety is a top priority, and the hospital employs strict infection control protocols and advanced monitoring systems to ensure the well-being of its patients. They also utilize state-of-the-art technology such as robotic surgery tools and diagnostic devices to enhance care while minimizing risk. This global approach is not only improves patient safety, but it also attracts international patients, refining their safety practices and reinforcing Houston Methodist's reputation as a leader in healthcare. So global and regional integration ties into Chapter 8. Regional economic integration, like the European Common Market, creates a more interconnected and efficient economic environment by reducing trade and investment barriers. So for Methodist Hospital, this could mean enhanced collaboration with healthcare systems and research centers and across all regions, allowing easier access to specialized treatments and talent. Also, with regional and global integration, it offers Houston Methodist the opportunity to innovate, attract, and international patients and enhance patient outcomes.
So I'm going to go with the diversity, equity, and inclusion of Houston Methodist Hospital. I tied this in with the concept 15.2, which is training and development in our textbook. This will help prepare employees and leadership to work in diverse healthcare and environments across the world. For research and development, the DEI trainings enhance understanding and improves an organizational culture. For their grant programs, which is their inclusion, they have an 8-week course broadening career opportunities, as well as $15.8 million to organizations since 2021. The key initiatives for these would be engaging with stakeholders, monitoring diversity, addressing disparities, and measuring impact. Their diversity, which is their demographics, would be 76% women, 24% men, and their leadership is 67% women as well. And then in their training, they support expertise with culture sensitivity and leadership skills for the skills of the world. Next. And then the leadership approach, we have transformational, which can focus on high principles to reduce errors and improve outcomes. Behavioral workshops develop leadership skills. In situational, leaders can adapt styles to meet team needs. And then in the shared governance, nurses can shape policies and practices.
And now we're going to be turning over to 16.1 in our text to go over the financing decisions over at Methodist. So their financing strategy is to, one, focus on outpatient growth, and to also their investment in digital health and the expansion of their physician network, and also cost containment initiatives. A few of their financial highlights are that Methodist has demonstrated strong revenue growth with an 8.5% compound annual growth rate from 2020 to 2022. Their net income has reached $533.8 million, indicating financial stability. And their operating margin is also 4.3%, which reflects efficient operations. And their debt to equity ratio is 0.67. Okay. A few of their strengths are that they have diversified their revenue streams, which reduce dependence on the single payer. The conservative debt management maintains financial flexibility. and also strong operating margin, which ensures sustainability. But however, they have a few weaknesses, which are one, their dependence on government reimbursement, which poses a little bit of uncertainty. Also, they have high capital expenditures that strain their short-term finances. And also, there's increasing competition from non-traditional healthcare providers, which requires Methodists to have to adapt a little bit more. Their opportunities for improvement are one, they can enhance their revenue cycle management, which would optimize their cash flow. Two, they can invest in data analytics and AI to improve their decision making. And also, they can optimize their supply chain operations to reduce some costs. And that is what I have for you. Thank you so much.
Thank you.
Thank you.